We turn now to COVID-19. Data continues to suggest that the Omicron variant is less severe than others, but the CDC warns that the surge will stress the healthcare system in the coming weeks. The most vulnerable, children, who are either too young to be vaccinated or are just not vaccinated at all, along with those over age 65. Here's Mark Strassmann.
Those people are not in line. Don't give them one.
It's the same scene all over. Americans on a scavenger hunt for COVID tests.
At this time, we are sold out of COVID tests.
Empty shelves, long lines. Colorado, Indiana, even Massachusetts, home to one of America's highest vaccination rates. And yet somehow Florida, long a bullseye for the virus, managed to let up to 1 million COVID tests expire in a warehouse. One critic called it heartless.
There wasn't a lot of demand for them. They've been sending them out as requested.
COVID anxiety and COVID testing are both spiking now that the holidays are behind us. This is Glynn County, coastal Georgia. 6 times as many people lined up for tests the first week of January than the week before. Omicron now surges everywhere with astonishing speed. Contact tracing's virtually worthless. Consider this. It took 6 months for the U.S. to report its first 4 million cases. The last 4 million took 1 week. This is Southeast Georgia Health System near Savannah. Its COVID patients more than doubled in 1 week.
Every bed's taken, the ER's full.
Nurses like Macy Floyd keep running a COVID marathon.
I don't know when a finish line will be. I don't see one. I think COVID is something we're going to be dealing with for a while.
Even more worrisome, the CDC says pediatric hospitalizations have hit a pandemic peak. Mostly children under 4, too young for the vaccine. In this week's COVID follies, the CDC's ever-evolving, consistently confusing guidance. Nearly 2 weeks ago, the agency halved its isolation recommendation for infected people from 10 days to 5. Then rejoin the world without passing a test first. Its new guidance: taking that test is up to you.
If that test is positive, people should stay home for those extra 5 days.
The American Medical Association is having none of it. Those recommendations are not only confusing, but are risking further spread of the virus. Experts predict Omicron's surge across the U.S. to peak soon. But no question, our next couple of weeks will be rough.
Mark Strassmann reporting in Brunswick, Georgia.